All right, I'm being joined now live in the studio by Dr. Zimro Sebastian, Department of Anesthesia, Sayahaya Memorial Hospital, Birnin Kebbi. Doctor, thank you for coming to the program.
It's my pleasure. Thank you, and good evening, viewers.
Now, Nigeria Medical Association, why do you consider this, what is it all about, this medical outreach?
Thank you very much for this opportunity. Free medical outreach, as considered by Nigerian Medical Association, is all about we, the professionals in the healthcare, giving back to the community that made us who we are trained, directly or indirectly. Directly by our parents, indirectly by the subventions from the government into scholarships and alikes. And then we were given these privileges in the institutions, and then here we are trained with the skills. And then on the other side, you have the people who are sick, who need these services. So we thought that this is the best way we could give back to the community, especially our host community.
I see.
Thank you.
Now, Doctor, why do the state chapter of NMA embark on this project?
We embarked on it because of the needs we see in all our tertiary care institutions. For example, in the Federal Medical Center and, of course, in Sayahaya Memorial Hospital, you see a lot of cases. The phenomenon we see is commonly referred to as the ice badge phenomenon. It's just tip of the iceberg, you see. The problems are out there. A lot of people cannot either access the health care because they are not aware. What we observe actually is that it's not that they are not aware, but they don't have the wherewithal to access this. First of all, to even transport themselves to access these healthcare services is really a problem. And then these problems are looming right there in the villages, in the suburbs. So that is the reason why the new ESCO, on assumption of office, under the chairmanship of Umaru Garba Kangiwa, they said, okay, medical missions is it. And therefore we embarked on it, and it went round the Emirates, and we covered all the 4 Emirates as we speak.
So you've covered all the 4 Emirates?
All the 4 Emirates. First of all, we were in Koko, which is under Gwandu Emirate, and next we were in Yauri, which is Yauri Emirate. Then we were in Argungu, which is Argungu Emirate. Then last of all, the Z in Zuru Emirate. Of course, that's where I belong.
All right. Now, is it a tradition of the enemy at the national level to do this, or you just decide at the state branch to organize this?
It is really part of the programs at the national level, and of course, it's extended to all the sister bodies, the state branches. We are also members, so it became a norm to us, and then the vision was really bought by our able chairman and indeed all the members of the honorable profession. Then we went into action, and then here we are today. We started a little bit very rugged, not too pleasant, but today we are very happy, and everybody shared the vision. And indeed, we are very proud that we are able to help out in our small way at the healthcare delivery system in the state.
Now, how many people benefited from this outreach program of yours? The one you embarked, the recent one?
The recent one, before the recent one, from the Gwandu Emirate, Yauri Emirate, and then Argungu, we saw as much as 9,000, total of 9,000 patients. Yes, 9,000 and above. But of recent, we just had 3 days outreach in Zuru Emirate. We saw 3,761 patients that really came out. That is to tell you that people know how to access healthcare. The problem is that the cost is prohibitive. Healthcare everywhere, we must note, and I want to draw the attention of all the people in government. Healthcare everywhere is expensive. The only way it can be assessed by them that are less privileged is when it is subsidized. When some well-meaning Nigerians say, look, we are going to make up for it, and therefore we embarked on this. So what we call the free medical outreach. Not actually free, because somebody else paid for it. Somebody else supported for it,
Yeah,
but the beneficiaries.
We'll come to that later.
Now,
what are the common ailments you come across during the exercise?
The common ailments, like when we went, we divided ourselves into 7 different subunits, and I will mention the subunits and the common ailments. In surgery, we had the commonest problem was hernia, and then we operated a couple of them, the hernias. We had a total of so many surgeries.
In the studio with Dr. Zimro Sebastian, Department of Anesthesia, Sayahaya Memorial Hospital, Birnin Kebbi. He is also the Chairman, Medical Outreach, Medical Emergencies and Disaster Management, NMA Kebbi State Branch. Doctor, we are talking about ailments.
Yes.
In Zuru Emirate, where you went to provide free medical services.
Yes.
The kind of ailments you see there and their possible causes.
Okay. Let me go through a breakdown. Like I was saying before we had the light out, we had, for efficiency of seeing and effectiveness of seeing all the crowd we saw, we consider it a Zuru tsunami.
There was really crowd.
A real crowd. We consider it a Zuru tsunami, if you like. So we had, in surgery, the commonest illness we saw was hernias. Probably because the Zuru people are hard-labored people, of course. Because of hard labor, increase in intra-abdominal
that's
pressure.
One of the causes.
Yes, one of the causes. So you have a large number of hernias that we operated. Part of the 169, a greater percentage, I can say almost 50% of that were hernias, and a total of 662 patients were seen in that section of surgery. Dental, in the dental unit, we saw a total of 118, and the commonest problems were dental caries. People have their tooth with a lot of infections there, and then many of them had to get their tooths extracted. A total number of 106 tooths were extracted. This is to aid healing and relief of pain, and they can have a replacement much later. In ENT means ear, nose, and throat. We saw a total of 147, and the commonest problem there is otitis media. A lot of pus coming out of their ear, and then they cannot hear or even hear what you're saying. That is the commonest thing we saw. And then one of the highest unit we saw, the highest number was in ophthalmology. That is the eye subunit. We saw a total of 900, almost 1,000, 948
ophthalmology
cases. It is very interesting here. I want to draw attention. The commonest problem, 2/3 of all the 948, that gives us a figure of 628 were cataract cases. Cataracts, simple cataracts. In Hausa is called Yana. These are the problems that the people have. Unfortunately, we are not able to do anything because we don't have the equipment there. The same thing we saw in previous Emirates, 2/3 of all that we see were cataract problems. Got to see all our specialists in that area. We have a consultant there.
Now, in that case, where you cannot do anything, you are handicapped, what do you do?
We refer them appropriately. We have such centers like the Hafsat Eye Center in Birnin Kebbi here, and of course the Federal Medical Center in Birnin Kebbi here. That is the commonest place we refer them to. But we look forward to one day we will have these facilities. Then we will go around all the Emirates again and do a mobile.
Because I think they're still handicapped because it's all about money.
It's all about money,
yes.
Like I said. Everybody knows what to do. Like it's commonly said, any better soup, na money kill 'em. So it's funds, that is the issue. Then in ONG, women's section, we saw a total of 402. The commonest problem was infertility, primary infertility, and malaria in pregnancy. Internal medicine, this is an area we saw 884, and the commonest problems were hypertension, diabetes, and peptic ulcer disease. These are the commonest problems in that area. And then in children, we saw a total of 601, and the commonest problem, very important, schistosomiasis, if you like, bilharziasis. They are passing blood in their urine. It's a common problem. We saw it in a particular area in Argungu local government, Argungu Emirate, and then we saw it in Gulma, where we had some kind of intervention there. It's really pathetic, and I think as we speak, it is receiving attention. I know that. Then malaria in pregnant, acute malaria is also one of the things, and then respiratory tract infections. Then it is interesting to note that we also had people who were given glasses, eyeglasses, about something like 400.
Maybe I need to stop you there. I'll have to invite you some other time to come and discuss more on this. Now, how do you access your drugs?
We access our drugs through reputable pharmaceutical vendors that we have, and the drugs are fully certified by NAFDAC, and then they are of high quality, and then we give to the patients.
Now, any contributions from individuals, NGO, government?
Yes.
Or you do it solely NMA affair?
When we started, it was an NMA affair, but it was a heavy load on us. We couldn't carry. We cried out. I remember we were in a program like this, and we cried out to well-meaning Nigerians. And then, indeed, a lot of sons and daughters of the lands, of the Emirates we visited, they did us proud.
That's good.
They supported strongly.
That's good
In
news.
Argungu, we had a very strong support from the son of the soil. He single-handedly sponsored the program that time. And then in Zuru, it was quite impressive. I think it's one of the richest outreaches we had. It was supported. We fondly call them our backbone. It's Kebbi State Shore Trust Fund. They really came into our aids. They were there, as you saw in the news before now. They were there behind us, before us, everywhere. And then they aided us in acquiring most of the drugs that we use.
All right, we say thumbs up for State Shore Trust Fund.
Yes.
Now, do you have any plan of taking this outreach program to remote areas?
Very well, we do have. Permit me to remind us that we also received some assistance from NS Onukogu, and that is in Zuru, and then also from one able son of Zuru by the name of Professor M.K. Abubakar, the former minister. We must mention that to him. Right. Yes, we have plans of reaching the suburbs. Like I said earlier, all the problems we are seeing were like some kind of tip of the iceberg phenomenon. The problems are right there in the suburbs. So we plan to go not just in the Emirates headquarters. We also want to reach out to the
now, there are cases you are able to treat in Zuru, and some you are not able to treat. Those ones that you are able to treat, do you like gather them and enlighten them? Okay, this is what causes this. This is what causes this. Avoid this. Involving yourself in exercise.
Yes. Part of what we do, there is, if you notice the breakdown, there are consultation units. In that consultation units, not only do we see the patient, we help educate them, give them the needed health care, the information they need, and to appropriately take steps to access their health care that they need accordingly.
Now, how will you describe the participation? Anyway, you've described it as tsunami.
It's a Zuru tsunami. Permit me to say this. In Koko, it was a Koko tsunami. In Yauri, it was a Yauri tsunami. In Argungu, it was an Argungu tsunami. Of course, in Zuru, it was a Zuru tsunami. Everywhere. Permit me to say this. Anywhere in this country, you organize free medical outreach. If you like, don't announce it. Just do it first day. The second day, you are going to have an overwhelming crowd because people are in their need.
Thank you very much.
Thank you very much.
It's good to have you on our program.
Thank you. Good to see you once.
All right. Thank you so much for being there for us. That's about the size of our package this evening. Let's do it again same time next week, same station. Until then, please take very good care of yourself. Good night.